My name's Jack from East Anglian Air Ambulance. Today I'm going to be demonstrating effective compressions and the safe use of an AED to support someone that's in cardiac arrest. Before I engage with the casualty, I'm going to be looking out for any dangers. That's in order to keep myself safe in this situation. The sort of dangers I may come across could be things like electrical shocks, slips, trips and falls, vehicles, other aggressors or bodies of water. After I've assessed any sort of dangers, it's safe for me to now engage the casualty. When someone goes in cardiac arrest, they become unresponsive. I'm therefore trying to check if they're awake and alert. To do that, I'm going to tap them on their shoulders and at the same time ask if they can hear me and if they can open their eyes. It should look something like this. Hello? Hello, can you hear me? If you can hear me, can you open your eyes? After checking for a response, I then need to get some help here. I'm going to shout for help as loud as I can to try and garner some level of support from those around me. When someone comes over, I'm going to ask them to locate the nearest AED and bring it back as soon as possible. But I also need to call someone. I'm going to get my phone out and I'm going to call 999. I'm going to let them know that I found someone that's unresponsive and that I need an ambulance sent as soon as possible. And I'm going to place my phone on speakerphone, letting them know the location of where they need to send that ambulance. Now that help is on the way, I can carry on my assessment of the casualty. At this point, what I'm going to do is I'm going to open up their airway. When you become unresponsive, what can happen is your throat will relax and your tongue may block your airway. So all I'm trying to do is move the head back to allow that tongue to be moved out of the way. The way we do this is we place 2 fingers underneath the chin, the palm of the hand on the forehead, and we lift the head back gently. It's called a head tilt chin lift. After I've opened up the airway, what I'm going to do is check if this casualty is breathing or not. In order to do that, I'm going to place my hand on the stomach or the chest. I'm going to bring my head down close to theirs and I'm going to look down the centre of the body, looking out for normal signs of breathing for a full 10 seconds. This could include things like rise and fall of the chest. It could be that there's flaring of the nostrils. I may feel their breath on the side of my face, or on a cold day, I may see that cold air coming out. But I'm going to make sure I do that for a full 10 seconds. If at that point they're not breathing or they're not breathing normally, I'm going to start chest compressions. It's really important that you kneel down next to the side of the casualty as close as possible. I need to find where my hands need to go on the centre of the chest. The way I'm going to find that on the casualty is taking the palm of my hand, bringing that up the side of the torso up to the armpit and then across to the centre of the chest. What I want is the heel of my hand at that point to be in the centre of the chest. I'm going to take my second hand, place that on top of my first and interlock my fingers, pulling my fingers back slightly. I'm then going to kneel up straight so that my wrist, elbow and shoulder are all in line with each other and my body is over the casualty. I will then start downward compressions. I need to be 5 to 6 centimetres or a third of the depth of the chest, going at about 100 to 120 beats per minute, and I need to allow for that full recoil of the chest. So after I come down, I need to allow that chest to fully expand again. Be reassured, the operator will be with you the whole time. They will talk you through the process and they will count you in while you're doing compressions to keep you in time. So doing effective compression should look something like this. I will do that continuously until further support arrives with the AED. At this point, support will have come back with the AED. It's really important that while the AED is being set up, continuous compressions are still going on. These should be turned on and they will talk you through everything you need to do in this process. Okay, they will inform you that you need to phone 999, which we've already done. The next step it will say is to prep the chest, exposing the chest as much as possible. They will come with a chest prep kit. These come with, as a minimum, a pair of tough cut scissors, a surgical razor, and a cloth of some sort. I'll use the scissors to cut at the side of the clothing, pulling that clothing out of the way. It will then tell me to take the pads out of their packaging and to place them onto the chest. These will be indicated of where you are to place them on the pads themselves, so please be reassured if you ever forget where they go. First one is going to go top right of the chest. Second one, lower left, just on the side of the rib cage. After these pads are in place, it will say that it is analysing if there is a shockable rhythm or not. If it decides there is a shockable rhythm, at this point we need to take our hands off of the torso and we will either indicate that we shock this individual ourselves or they will be automated defibs. It's really important through the analysing process and through the shocking process that our hands are away from that casualty and you are making sure any dependents or other people in the area are clear of that shock. After the shock is delivered, I would go straight back to delivering compressions, and every 2 minutes it will analyse if this individual has a shockable rhythm. So what we'll go through now is showing you the effective use of the AED just as I've described.
Call emergency medical services now. Adult mode. Follow the voice prompt calmly. Remove all clothing from chest and stomach. Rip clothing if necessary. Take out the pads from the bottom of the device. Tear open the pads packaging. Look closely at the picture on each pad. Peel off the pad labelled 1 and stick to the bare skin of the patient, exactly as shown in the picture. Peel off the pad labelled 2 and stick to the bare skin of the patient, exactly as shown in the picture. Press the pads firmly to the bare skin of the patient. Do not touch the patient. Analysing heart rhythm. Shock advised. Stand clear. Press the flashing orange button now. Shock delivered. Begin CPR now. Press the flashing blue I button for CPR voice prompt.
Every 2 minutes, the AED will analyse if there's a shockable rhythm or not. There are several reasons why you would stop doing CPR. One of those is when the AED tells you to stop delivering CPR. The second is when the paramedics arrive and we've done a successful handover. The third is when there's positive signs of life. And the last one is if at any point that danger level changes. If it's not safe for you to carry on delivering compressions, and one of those reasons could be physical exhaustion, we are going to stop doing compressions and maintaining our end safety. If you'd like to learn more about our CPR training, please visit our website and you can book onto our 1 hour long courses covering CPR and the safe use of AED. And together we save lives.